serving all of San Diego. This is your Fox 5 News.
And then a new trend for people who are getting over a divorce. How about plastic surgery? More on the so-called surgical vengeance. We'll be right back.
It's being called the ultimate payback after a breakup, vengeance plastic surgery. So here to explain this growing trend is plastic surgeon Dr. Vincent Marin and divorce attorney Jennifer Segura. Good morning and thanks for being here.
Good morning, thank you.
All right, plastic surgery like vengeance. This is really happening, doctor?
Well, you know, we see some of it out there. I think it's kind of, it's been the one thing that is newsworthy in that respect, but I think vengeance is kind of the wrong way to go about it. What we're seeing more and more, at least in my office, is that we're seeing patients that are coming in after having had a divorce, feeling bad about themselves and looking for some way to kind of get themselves back into their new life.
Okay, so what are some of the things that they're asking to do?
We get a lot of patients where stress really affects where you see it the most is in the face. So you can kind of see a lot of patients will come in, their eyes look tired, they have those bags under the eyes, want to get that corrected. Facelifts, younger.
Like this?
Yeah, we'll see some of those patients, before and afters, where what we're not trying to do is not make that patient look different, but just make them look better. And so you'll see the older patients can be in that range. We also see patients that have had babies and come in want a little pick-me-up with respect to their body. They're going out on the dating market, and you know, if it's the husband of your or the father of your child, it's easier to get away with, you know, having some of the changes that have resulted when you're out and it's kind of a new relationship. Women want to kind of put that behind them and start fresh.
Yeah, but they're waiting until after. I mean, maybe a lot of times people should be doing this during if they wanted to do it.
Absolutely, there is something, and what you don't want to see is someone who kind of neglects himself or fails to keep up with, you know, just maintaining an attractive appearance to kind of keep that spark in the relationship. But it is something that I think up front much better, but we do see patients as a result of having a bad relationship see this as a way to kind of get a new start.
I want to see a few more of the pictures because I want to get an understanding of what women and men, because it's both of them.
Absolutely.
Both of them are doing this.
Right.
What is this?
These are just fillers. We're seeing patients that are using a Restylane or a Sculptra type filler. These are just fillers that go into the folds just as a freshener. Obviously this is a younger patient and you'll be able to just kind of do a touch-up, something where they're starting to see a little bit of the aging process, that stress starting to show. Here you can see a patient had her upper and lower eyes done, and you can see that kind of that bag underneath the eyes, that dark circle, and you can kind of refresh that with you know, a 1-2 hour surgery and really kind of give her a brighter appearance. And then some men too, they really start to see men that will come in for upper eyelids. That's what this is, but you see patients coming in for faces. And also men tend to put on weight, whereas women tend to lose it through this kind of a stressful period.
I'm sorry, say that again. So men tend to put on weight during a divorce?
Through that stress, they tend to put on weight, and women tend to, depending on how they handle the stress or depression, can go in either direction. But men may come in and they're looking for, you know, liposuction because they've put on an extra few pounds because, you know, they're not taking care of themselves, they're home, they're not working out, and that stress just gets to people.
Let's talk a little bit about that stress, Jennifer, because a lot of times when people come to you as a divorce attorney, I mean,
a divorce mediator,
mediator, people that experience divorce, and I know this because I've seen some people go through this, I mean, it's really almost like a loss of life for a lot of people.
Absolutely.
So you lose a lot. Do you tend to find people that are going through this, sometimes they're grabbing onto this to get themselves out of it, or is it something really to just start fresh and it's part of this whole get rid of the old life and start a new one?
Well, I often find that when the couples start mediation, the woman is more likely to be the one not wanting to have the divorce, whereas by the end of the mediation, now the husband is a little bit more, what have I done? And the wife is moving on. She's lost the weight, she's, you know, eating better, getting out there, exercising, dating, and all of a sudden the husband starts to realize, maybe I made a mistake, you know?
You know, and doctors, during sometimes some of these very stressful and traumatic times in one's life, you might think that you want to turn to plastic surgery and you start to make decisions that maybe a few years later you're like, do you see that people make very drastic decisions and want to do drastic things during this time, or are they very subtle?
Well, the big problem is exactly what you're saying. Patients that are saying, I'm going to have this be some kind of vengeance, or I'm going to get back at my spouse.
Do they tell you that? Do your patients tell you that? Like, I want to get back at them?
Not necessarily, but it does come out as you start to question them more and find out. I always want to find out what the motivation of my patient is to kind of undergo surgery. And as you start to talk to them, it's not something they put out there right away, but it does come out. It's not too far deep beneath the surface, so it's pretty easy to get out of a patient. But when you see that, what you don't want to do is have a patient rush to this while they're in that kind of angry phase. You need support, you need family support, you need help, and you also need to have your mind in a good place. So you want to make these decisions after all of this, you know, kind of stress has calmed down.
Yeah, because it's a phase, it's a process,
Absolutely.
and it's trauma. You got to get out of it before you make these decisions, because you can't go back on a lot of them.
You're
Dr.
exactly
Vincent Marin
right.
and Jennifer, thank you so much for being here. You guys are coming back in the 9 o'clock hour.
Yeah, I'll be back, and we're going to talk a little bit more about how you age too. So,
yeah, how looking at your mom maybe is going to show what you're going to look like.
What's going to happen.
That's going to be cool.
So, yeah,
well, thank you. We look forward to that,
Thanks
Raul.
for having us.
Thank you all very much. Good information.